Hi, Debbie here. I am so glad to have you joining me. This is really exciting to be able to share all this wonderful knowledge and all these insights for you so that we can be partners in improving your health. So before we start this series called Naturopath Secrets Revealed, we need to figure out and define what is a naturopath. So naturopathy itself is actually a belief in a special energy. That energy is called the vital force. And that vital force actually has an intelligence, and it's working to control all the processes in our body. And it's always working to maintain this thing called homeostasis balance, better known as health. So really the body is always working towards healing itself. And so that, as a naturopath, my job is to honor that innate wisdom and healing ability of the body. My job is to help support that process by giving it the right nutrients, the right environment, the right mental emotional state, the right energy. All of these things together that support the natural healing process in the body. I want you to understand, when you embark on this journey of natural healing, that there's the most important principle that you're going to learn is called self-responsibility. Everyone is so unique. They have different chemistry, different DNA, different environment, different beliefs, different culture. Everything about an individual is so very unique. So it's so important that not all substances are going to react in the body the same way for every person. That's probably why there's hundreds of blood pressure medicines. So you really just need to be aware that you need to be self-responsible, meaning you need to pay attention to what makes you better and what makes you worse. You need to pay attention to what's positive in your life and what's negative in your life. So this is going to be the most important thing that you're going to find when you do your natural healing, is this level of self-responsibility. I have a dear friend that saw many people getting well on this very low-calorie diet, and she really wanted to be able to do it. So she was determined she was going to try it, and the first time she got faint and almost passed out. And so she took a break, decided she'd try to do some other things to get a little healthier, and she's going to try it again. And the next time she got faint and almost passed out and started to aggravate her heart arrhythmia. And see, it's important to recognize that sometimes certain programs aren't right for you. Like even for diet, some people do better on a low-carb diet. Some people do better on a low-fat diet, you know. But you have to learn what works with your body. And sometimes you're just not strong enough at that time to do that program. Another thing with self-responsibility is, many years ago, a book hit the holistic market. It was called Eating Right for Your Type. And it basically was some studies and research on how different blood types did better with different types of foods. And I'd hear comments like, wow, I tried to be a vegetarian and I felt so bad. It's nice to know that's why, because O's do better with meat. So you have to look at the fact that the body was already telling that person something. If they'd have been listening to and being self-responsible and paying attention to the body. But as human beings, for some reason, we like outside validation. We want somebody else to validate, which we are already being aware of. The bottom line is you really have to pay attention to your body and your life. Now, a finer line, this is where it gets a little muddy, is that whenever you go on a healthier diet or give up an addictive substance, you're going to go through a period of detoxification or withdrawal. And that can be pretty uncomfortable. So, in fact, alcohol withdrawal can actually be fatal, and they take it very serious in the hospital. So when you're going to a healthier environment, healthier lifestyle, if you've been in an unhealthy lifestyle, you're going to have to go through that period of detoxification. So you're going to have to know your body and your level of health to know whether you're going to be able to do it on your own or you need to be monitored closely by a doctor. You know your health. Nobody else knows it and can pay attention to what's going on in you better than you. So it's just important. For example, someone was on a colon cleanse, and when the colon cleanse, you're releasing toxins from the body, and the body's working to deal with those and to get rid of those, and that's a natural thing. But when the person went to have a cigarette, they says, "Wow, I was still standing, and I could still see everything, but it was like there was this big black cloud. Everything went dark when they took a drag off that cigarette." Now, their body could normally deal with cigarettes. The liver could detoxify the toxins from the cigarette. But with the liver working so hard to detoxify the stuff from the colon cleanse, it was already stressed, and the cigarette was just a little bit too much. Now, luckily, all the symptoms went away right away, and the person was fine. But it's definitely something to pay attention to, the body telling you that there's too many toxins here. So you have to drink more water and flush and do the right things. Maybe talk to the practitioner that you're working with. And now the other thing is when you're dealing with allopathic medicine or traditional doctors, you're dealing in structure. Now when you're dealing in structure, it's real easy. You can see an x-ray result. You can see an MRI. It's real easy to see what a blood pressure is. You can take a heart rate. You can take a lab test. And you can see what the result is. But medicine itself is not a science. Many people actually think that medicine is a science. It's actually an art. So it would still be a good idea to be self-responsible when you're seeing your traditional doctor. If you're getting blood pressure medicine, it's important to pay attention to what's going into your body and what the side effects are. There are hundreds of blood pressure medicines, so if you're getting swelling, decreased libido, you're feeling extremely fatigued when you're on your blood pressure medicine, find a doctor that's going to work with you and your body to find a medication that's going to actually work with you and your lifestyle. It's going to make your life better. The other thing is when people don't fit in a box. And what I mean by not fitting in a box is you go to the doctor and you have all these symptoms. And you tell the doctor what your symptoms are, and they say, well, you know what, your lab test is normal, I don't see anything on your x-rays, there's nothing wrong with you. And you're thinking, well, this isn't all in my head. I'm really having this experience, and I'm trying to be self-responsible and seek out some help. This happened more often, a lot of times in our practice. In the early 90s, people were coming in, and this was in the early phases when they were defining the chronic fatigue and the fibromyalgia and the autoimmune diseases, where people had gone to many doctors and, felt like it was all in their head, and they were still seeking help. So you need to be able to, what I want to express here is that as human beings, I can define it as rather arrogant that we would think that we have all the answers. And you can even look at your own kids. I know I can look at my kids and they have all the answers. That's part of human nature, is that we have the answers. But if you look back several centuries, and we can laugh at the people that thought the world was flat. Fast forward several centuries and they're going to laugh at us and some of the things that we're doing now. So we just need to stay open to the fact that there's so many more answers and things to find. So we work with what we have, and then we look for more possibilities and answers. I guess the next thing I would say is each and everything in this world has a purpose. So every day in doctors' offices and hospitals, there are countless people helped by very intelligent, motivated, well-meaning individuals that truly want to help people. The problem is when you wait till something shows up structurally and you actually have a disease, it's very expensive to take care of that and reverse it. It's not easily reversed, a chronic disease. what we want to do is we want to, well, let me back up again. So right now, our healthcare system is very stressed. When you're looking at the payer mix, that there's, they lose money with Medicare, that there's less people with insurance, so more people are self-paid and they lose a lot of money there. The hospitals are already stressed. And then with healthcare reform, with a government program, they don't expect more money. They expect less money. So with less money, they're going to have to be more efficient and give more with less. I think your best defense in that situation is to learn to take care of yourself and be healthy now. That way you don't end up with a chronic disease and end up dependent on that system. Let's get on the wagon, learn how to take our care of ourselves, be self-responsible, and live a better quality of life. So, in this series, I'm not going to diagnose, I'm not going to treat, I'm not going to prescribe. I am going to offer you knowledge and new tools and new ways to look at yourself, to be self-responsible, to be self-empowered in your own health. We're going to partner in getting you this knowledge so that you can help yourself be healthier. So some of the things we're going to cover in this program, we're going to cover for the body include like nutrition, enzymes, cleansing, acid-alkaline balance, homeopathy, herbs, supplements, exercise, breathing, yoga. We're even going to talk about the DNA and the research on the DNA. For the mind, we're going to talk about stress, beliefs, programming, values, contemplation, balance, and emotional freedom technique, a method of freeing the energy in the along the meridians and in the body. For the spirit, we're going to talk about prayer, meditation, quantum field, miracles, and spiritual healing. So much wonderful knowledge. I'm hoping you're going to join me on this series of video podcasts. Feel free to join me each week for the podcast or join me on my website at naturopathsecretsrevealed.com. Debbie, signing off.